So na-answer na ako mga all relevant things here. And let's try to answer it if maka-remember pa ta. So, vaginal infection is wala man day siya day. Kaya more on STD siya. So, I skipped that. And here we started with uterine fibroids, which is growth, bitaw. Fibroids na siya sa katong 3 things na kuan uban sa endometriosis og sa leiomyolomas, di ba? So, here we have a 39-year-old female client has been experiencing intermittent vaginal bleeding for several months. Her health tells her that she has uterine fibroids, recommends an abdominal hysterectomy. So more on the questions here is all about hysterectomy, just the removal of the uterus. When the client expresses fear about the surgery, what should the nurse do? So maura na give the opportunities to express her fears. Dysmenorrhea and menorrhagia. After reviewing the laboratory reports, the nurse should report which results to the healthcare provider. So, kung nasa uterine fibroids, more likely she will also have bleeding. Munang nasa menorrhea o dysmenorrhea. Dysmenorrhea, painful your menstruation, diba? So, magamay ang ato ang hemoglobin and hematocrit, ana. The client will have an abdominal hysterectomy tomorrow. Which information will be the most important for the nurse to give to the client prior to admission of the hospital? Na siya abdominal hysterectomy tomorrow. So, information nga kuan. So, the type of pain medication, the amount of activity, what she can eat and what she can drink before the admission kay ang anesthesia something magkakasag aspiration, diba? So the nurse is witnessing the client's signature on the informed surgical consent for abdominal hysterectomy. The nurse should be certain that the client understands that what will be the outcome of this surgery. Infertility kay no more uterus means no more place for the baby and no more menstruation. So which is the correct order from first to last? Proper placement of urinary catheter. So sterile field, lubricate, insert, and ensure the free flow of urine. Which physical sensation will the client who has had an abdominal hysterectomy most likely experience if she hyperventilates while performing deep breathing exercise? So dizziness. Wait lang.
So thank you so much for reading this. Now, hindi na ako mag-start from the scratch now. I'm actually going to activate or try to answer what is being asked here. So, which nursing measure would most likely relieve postoperative gas pain for abdominal hysterectomy? So, date last na po, 7 a.m. pa, 10:54. It's okay. You know, I just really want to express my concerns in the bus. Like, I thought makastudy ko there, but that's okay, you know. Hopefully, si Lord ang mag-tulong sa atin tomorrow. So, we're going to not work. I would stop all other distractions and focus on right now. So, physical sensation will the client who has had an abdominal hysterectomy is chances magka-dizziness siya. Because this is a characteristic sign of hyperventilation is dizziness. Ano ganit? Kanina kabalo ko. So rapid and deeply that she exhales excessive amounts of carbon dioxide. Ayun. So, to avoid hyperventilation, the nurse should assist the client to have slowly breathing. So, which nursing measure would most likely relieve postoperative gas pains after abdominal hysterectomy? Offering heart opens and fitting abdominal liner in the client's walk. So, ipa-ambulate na to siya para makakapag abdominal hysterectomy. So, on the second postoperative day, after an abdominal hysterectomy, the client develops a temperature. What should the nurse do first? So, obtain culture sensitivity, study of the urine and the source, ensure that the client gets at least 10 breaths, change the site of catheter to reduce the risk of infection, increase the number of warm dressings. So, the answer of this is ensure that the client gets at least 10 breaths every hour because elevated temperature is associated with respiratory infection and So, mao to, on the second day postpartum, common na siya mahitabo na magka-increase in temperature. So, it is very pinakauna manggod ang giingon. So, take na to ang patient of at least 10 deep breaths. So, the nurse is changing the dressing of a client after an abdominal hysterectomy. If the dressing adheres to the client's incisional area, what should the nurse do? So, if the dressing adheres to the client's incisional area, what should the nurse do? The nurse is changing the dressing of a client after an abdominal hysterectomy. Yeah. The dressing adheres to the client's incisional area. What should the nurse do? Pull off the dressing quickly and then apply side pressure. Dressing with sterile mask and then remove for the animal during the body. If any silly portion of the dressing, then the nurse. I think it's number 3, moisten. Yes. It's best to moisten the dressing with sterile water saline. So the client with an abdominal hysterectomy is being prepared for discharge in the morning. The client has a special needs, the client has special needs adult son who cares at home. The nurse should discuss the health, the provider, social work. When planning discharge instruction with a client who has had a abdominal hysterectomy, what should we do first? Have the client eat their canal? No. Call the social worker to the brief and discharge first. Okay, nag-discharge na siya. So I think i-assess mo social supports, D. Yes. Because first step is patient education. It's a key aspect of digital pregnancy begins when the client is admitted to the hospital. What assistance support the client has at home? Well, before i-discharge, kailangan mo na siya i-say support sa patient at home. Kasi directly to others is returning to the nurse. Wala akong di-appear. When okay, kung wala ko nag-i-appeal po, pero sige, i-ask na to sa answer ang the client should be prepared what to expect after surgery. So, the client can push the brake pedal without pain. The nurse should instruct the client to avoid activity until, so driving, until the client can push the brake pedal without pain. So, dili ka dahil ka maka-do anin. So, bawal ka mag-driving, guys. Bawal ka drive. So, wala na ako nag-buhat. The second day following abdominal hysterectomy, the client reported he has had 3 blown loose stools in moderate amount. The morning medications include a prescription for 100 mg for glucosate sodium. So, wala magod na medication na narigalan. So, hindi yung magawas. But glucosate sodium is for, I think the answer is 3. Really for sure. 3 ang answer. Without the medication and document the report of these stools. So, doctorates stool softener. Okay, so, yung doctor na has loose stool, the nurse, i-stop niyo siya kay number loose stool ang patient. So, nga magbuhat pa man ka o stool softeners, diba? So, yun na. Then lastly, which information should the nurse include when teaching a 55-year-old woman in beginning menopause? The average of 52 hot flashes. So, breast cancer na ka. So, a nurse is palpating a female client's breast for assessing for breast disease. So, commonly found siya upper-outer quadrant. Ngayon, the client states that she has noticed that her bra fits more snugly at certain times of the month. She asked the nurse if there is a sign of breast disease. So, it's normal for breast to increase in size before menstruation begins. That's the answer. Okay. No. Saan ito na number? 94. Okay, the breast may vary in size before menstruation because of breast engorgement caused by hormonal changes. Many may then note that their bra is more tightly than usual. So it's a thing that make a book that breast may feel the breast may feel more tight. Hindi ko siya before menstruation, diba? So, 70-year-old clients asked the nurse if she needs to have a mammogram, which is the best nurse response. The best incidence of breast cancer increases with age ng So, kailangan din mo, on. Ano ang kailangan gawin mo o
So, maybe mabagay siya din if hindi na ko siya if ako siya with audio. Basta. So, client undergoing chemotherapy after modified radical. So, brought na siya breast, saan yung breast prosthesis? So, siguro ka na pressure breast, bra. So, cancer support group na to siya. So, naka-radiation therapy after a modified radical mastectomy. What instructions should I teach the client about caring for the skin at the site of the radiation therapy? So, ipawash lang mo siya with water. Sakto pa, 35. Yes, should avoid lotions, ointments, and anything that may cause irritation to the skin, such as exposure to sunlight, heat, or powder. So, the area may safely be washed with water if it is done gently and care is taken not to injure the skin. So, the client is to have radiation therapy following a mastectomy. What should the nurse tell the client to expect as normal local tissue response to radiation? So the client is to have radiation therapy. Following mastectomy, what should the nurse tell the client to expect as a normal local tissue response to radiation? Huh? Ano sa man yung expect as a normal local tissue response to radiation? It's a normal local tissue response to radiation. Tell the client to expect as a normal local tissue response to radiation. So, redness of the surface tissue. So, following mastectomy, sama mo iingon sa client na expect nila mo ha. So, mag-ingon ka sa iya nga magkaroon siya ng redness of the surface tissue. Magkaroon siya ng redness of the surface tissue, which is crazy. So, skin radiation is redness on the surface tissue. Dryness, stunting, and capillary dilation are also common. 37. The nurse is providing instructions about preventing infection to a client who had a modified radical mastectomy and will be pruning flowers when she returns to work. To prevent infection, what should the nurse instruct the client to do? Wear protective gloves when gardening. Pruning, to be specific. So, cancers with an infection. Protection to avoid creating any entries tight for infection in the affected arm when wearing protective gloves, using cuticle cream and not cutting cuticles. Okay. So we will move on to BPH. An adult male client has been unable to avoid for the past 12 hours. What is the best method for the nurse when assessing for bladder distension? So because the dullness of the left lower colon. So dullness indicates that it is distended or full. So when emptying the client's bladder during urinary catheterization, the nurse should allow the urine to drain from the bladder slowly to prevent which complication. The answer is sudden change in pressure among both causes. Renal failure or possible shock. The answer is sudden shock. So, possible sudden shock. So, kailangan na allow the urine to drain from the bladder slowly radyo mo ipa-drain to prevent possible shock. The primary reason of lubricating the urinary catheter generously before inserting the catheter to a male client is to prevent which problem? Number of organisms, the formation of obstructive spasms of the friction along it. So I feel like it's friction. 40B. Liberal lubrication of catheter tissue may reduce friction along the urethra and traumatic tissues. So the nurse has inserted an indwelling catheter in a male client. Which problem is prevented if the nurse tapes the catheter laterally to the thigh? So laterally to the thigh, the nurse has inserted an indwelling catheter in a male client. So nag-insert siya of indwelling catheter sa thigh. Which problem is prevented if the nurse tapes the catheter laterally to the thigh? So, obstructing the flow when the client turns, accidental catheter kinking, pressure at the, siguro kay accidental catheter removal, 41. For tapping and the catheter lateral aspect of the is held in a lateral position to prevent pressure at the ankle angle. So, dili dahil ni siya, like, bawal mo siya kumato. Unsay problema ma-prevent if tape ni mo siya laterally sa latay. So, pressure to the penoscrotal angle di ay ang answer. So, malikot dili. The nurse is providing preoperative instructions to client who is having a transurethral resection of the prostate. So what should the nurse tell the client? You should expect blood in your urine in the first couple of days following the procedure. When providing a client teaching about continuous bladder irrigation, so following prostate surgery, what should the nurse tell the client? So the purpose of irrigation is to keep the bladder drainage clear and to prevent the formation of blood clots in the bladder. So when caring for a patient with history of BPH, what should the nurse do? Provide privacy, monitor intake and output, ask the client if he has urinary retention. The client has prostatic hypertrophy. What should the nurse assess when conducting a focused assessment of a client's ability to urinate? Focused assessment, difficulty starting the flow of urine. I don't know why. So signs and symptoms include
difficulty starting to flow of urine. So, kung naka BPH kay makalisod ka paihi kay mo man jud ni ang BPH kay nakoy mang prostate ang urethra something na ipit. So, a client is scheduled to undergo transurethral resection of the prostate. The procedure is to be done under spinal anesthesia. So, what nurse assess the client after, so magkaroon siya ng respiratory paralysis kay. Ila naman jud na siya. Magka-respiratory paralysis ka if magka-respiratory paralysis ka kay imuhang cholinergic effect. If paralysis of vasomotor nerves in the upper spinal cord occurs, paralysis of vasomotor nerves in the upper spinal cord occurs when spinal anesthesia is used. So, paralyzed ang vasomotor nerves in the upper spinal cord occurs when the spinal anesthesia is used. Dali ka siya. So, yeah. Dirazosine is an antihypertensive drug used to treatment of BPH, pero antihypertensive man gud siya, so be wary of blood pressure mo i-take note. Kaya ano galing ko on vasomotor nerves, of course, respiratory paralysis. Wala ka siya explain nga sa relation sa respiration, pero upper spinal cord man gud when spinal anesthesia is used, magka-respiratory paralysis yung kana. Client who has had TERP has a 3-way indwelling urinary catheter with continuous bladder irrigation. The circumstance should the nurse increase the flow rate of the continuous bladder irrigation when drainage becomes bright red. So, kanos daw i-increase ang flow rate sa continuous bladder irrigation. Kay the purpose of irrigation ba kay para the bladder should be increased when the brighter red. The color indicates the presence of blood. It helps to flush the catheter. So, para mangod kuan ka ng ang purpose sa irrigation para dili bitaw magkaroon ng blood clots. So, kung mawala ang blood clots, kung ay bright red, magkakaroon ka possibility of na ay obstruction. So, a client is to receive belladonna and open suppositories as needed post-operatory after transurethral resection of the prostate. The nurse should give the client these drugs when he demonstrates signs and symptoms of which pain from bladder spasm. So, pain from bladder spasm. Nasa kong bag itong sa laptop. So, an unlicensed assistive personnel, pain from bladder spasm, opium suppositories, belladonna plant spasms, pain. So, an unlicensed assistive personnel does, I think the client is confused, keeps telling me he has to void, but that's not possible because it's a catheter. What should the nurse tell the UAAP? So, the urge to void is usually created by a large catheter, and he may be having some spasms. A healthcare provider has prescribed amoxicillin 100 PO 2 times a day. What should the nurse instruct the client to do? Drink the water. Yes. Void frequently. So, ang giingon dire, walay about sa drinking fluid kay ang to promote output 250 to 3,000 dili 500 ml 250. So, gamay ra day kay 300 og 1. So, mali ni siya. So, dapat na 0 dire. So, in discussing home care with the client after transurethral resection, sa 2, 4, 3, 5. 2, 3, 4, 5. So, in discussing home care with the client after transurethral resection of the prostate, what should the nurse tell the male client about dribbling of urine after this surgery? So, can persist for several months. So, kung mag-TERP ka, ingnan mo ang imong male client nga mag-dribble or baka ni dribble, pero client should be informed that this is expected and is not an abnormal sign. Dribble, pero hindi ito. Dili basketball. So, kapit naman sa BPH, a client is being discharged to home 3 days after transurethral resection of the prostate. What should the nurse instruct the client to do? Yes, 3,000 ml to 500 ml man daw. Diba? 25 to 3,000 ml. Report rapidly and report to Vernon. So, 250 ni guys to 5,000 to 3,000, dili 500 ml. So, a client with benign has an elevated prostate specific antigen. So, what should the nurse do next? So, the nurse should instruct the client that a urologist will monitor the PSA level manually. No. What should the nurse do next month? I don't know. Rectum birthday. Determine if prostatic palpation was done before or after blood was drawn. So, the prostatic palp should be done after blood sample is drawn. The PSA must be monitored because when nato something nga mo increase bitaw siya, i-increase niya kung mapalpit ni mo siya, so dapat dili ni mo siya ipalpit sa kay maka-increase siya sa PSA levels. So we are done with that. Moving on to the care of the clients with cervical cancer. So the nurse is preparing a client for a vaginal examination. The nurse should place the client in which position? Palithotomy nimo position. So ang gi-answer ani kay dorsal recumbent, pero ang pinaka-appropriate din na pang vaginal examination kay lithotomy. The client asked the nurse explain the meaning of her abdominal pap smear result of a typical squamous cell. The nurse should tell the client that an atypical pap smear means that what has occurred. The cells cause various conditions and help identify a problem early. Yes, so this kind of cells produce various na mga conditions in which hindi pa kayo takabalo, no? So what is the risk factor for cervical cancer? Adolescent and pregnancy. Cervical cancer? Yes, adolescent pregnancy. So bata pa ka na kuan, cervical cancer ka na. Whereas obesity is ovarian. A woman tells the nurse, there has been a lot of cancer in my family. The nurse should instruct the client to report which possible sign of cervical cancer, light bleeding or watery vaginal discharge. So when we say vaginal discharge, cervical cancer did not siya. The 30-year-old female client asked the nurse about Dutching. What information? Dutching removes natural mucus and change the balance of the normal flora. So a young woman will receive 6 months of chemotherapy for cervical cancer. She is a single parent of 2 children and no longer work. The nurse contracts a social worker to help continuing care. The client states, I feel overwhelmed. How can a social worker help me? So select all the apply. Dili kayo ni siya magawas 1, 2, 3, 4 tanan. So not worth my time. The husband of a client with cervical cancer says to the nurse, the doctor told my wife that her cancer is curable. Is he just trying to make us feel better? So which is the most appropriate response of the nurse? When cervical cancer is detected and treated aggressively, the cure rate is 100%. A client with suspected cervical cancer has had a colposcopy with colonization. What information should the nurse give the client about her menstrual period after this surgery? Client with suspected cervical cancer na siya colposcopy with colonization. So, conization. What information should the nurse give the client about her menstrual periods after the surgery? Her next 2 or 3 periods may be heavier or more prolonged than the usual. So may igatag sa nurse about the client about menstrual periods. So cervical cancer causes her next 2 to 3 periods can be heavy or prolonged. So muna yung iingon sa iya ha. Than usual, heavier or prolonged than usual cervical cancer. So a client with cervical cancer is undergoing internal radium implant therapy. A lead-lined container and a pair of long forceps have been placed in the client's hospital room. What should the nurse tell the client about how this will be used? The forceps and container will. So client with cervical cancer undergoing internal radium. Wala, naguro dito. And a pair of long forceps. So, unsa kita forceps? Pang kuan sa second stage of labor or pang rotate sa baby? Balik ako sa answer. Guys, a client with cervical cancer is internal radium implant therapy. Lead the container and a pair of long forceps have been placed in the client's hospital room. What should the nurse tell how this will be used? So the forceps and container will be used for handling this large radiation source. So the mother of a client who has a radium implant asked why so many nurses are involved in her daughter's case. She states, doctor and I said I can be in the room for up to 2 hours each day, but the nurses say they are restricted to being there. What should the nurse explain to the nurse? So touching the client, which increases exposure to radiation. Yeah. Client with HPV is being treated by colposcopy. The client asks the nurse if this procedure is really necessary. The nurse can tell the client that if the HPV infection is not treated, which health problems likely to occur, cervical cancer, which action should be included in the nursing care for a client with cervical cancer who has an internal radium implant in place. Internal radium implant in place. Which action should be included in the nursing care for a client with cervical cancer who has an internal radium implant in place? Offer a low residue diet. Why man ka mag-gamay og diet? Mag-diet ka kung naka-internal radium in place for cervical cancer. So bowel movements can be difficult with radium applicator in place. So the purpose of low diet is to decrease bowel movements. So a client is being treated with internal radium implants. The nurse should assess the client for which adverse effects associated with radiation therapy to the cervix. A client is being treated with internal radium implants. The nurse should assess the client for which adverse effects associated with radiation therapy to the cervix. Nausea and foul vaginal discharge. Basta cervical cancer, vaginal discharge. So we are going to move on to the ovarian cancer. When teaching a client about ovarian cancer, the nurse should include which information? Need for routine colonoscopy at the age of 3, symptoms occurring early in the disease process. So Interprofessional management of ovarian cancer includes which measures bilateral self-lippincottomy to remove the disease, radiation therapy to eliminate all cancer cells, walay chemotherapy to cure cancer is wrong because we're not curing cancer with chemotherapy in ovarian cancer, but chemo is used. A client with ovarian cancer asked the nurse, what is the cause of this cancer? The most accurate response by the nurse is use of oral contraceptives. The risk of developing ovarian is related to environmental, endocrine, and genetic factors. So the nurse is planning a presentation about ovarian cancer to a group of women, which topic should receive priority attention in the lesson plan. Ovarian cancer is signs and symptoms are often vague until later in the development. So vague ang signs and symptoms of ovarian cancer, but they are very prominent sa later parts. So testicular disease na to, then last na dayon ang client with prostate cancer, and then we're done with this part. So we're done with this video. A 28-year-old male is diagnosed with acute epididymis. What should the nurse assess the client for when conducting a focused assessment? So a 28-year-old male is diagnosed with acute epididymitis. So what should the nurse assess the client for when conducting a focused assessment? Severe tenderness and swelling in the scrotum. Why? Severe tenderness and swelling in the scrotum. Okay, this man, epididymis man and scrotum are related, so that's why focus assessment ta sa scrotum or epididymis. So what is the relationship between epididymis and the scrotum? So comment down below. A 30-year-old client is being treated for epididymitis. What information should a nurse indicate in teaching plan about the likely cause of epididymitis? Sexually transmitted infection is a likely cause of epididymitis. Mas wicked cause. So, because tenderness pronounced in the scrotum, gradual onset without scrotal pain. So, yeah. Munang pag epididymis kay scrotal pain and epididymitis, scrotal and what? Perineal. When teaching a client to perform testicular self-examination, when should you do it? After a warm bath or a shower. So, the nurse is assessing a client's testes, which finding indicates testes are normal, egg-shaped. Which is a risk factor for testicular cancer, undescended testes. A client with a testicular malignancy undergoes a radical orchiectomy. What should the nurse assess the client for during the immediate post-operative period? Pain. Pain ba? Client with testicular malignancy undergoes radical orchiectomy. What should the nurse assess the client for during immediate post-operative period? Pain? Pain ba? I don't even remember. So, because of the location of the incision in the high inguinal area, pain is a major problem. Right orchiectomy is performed on a client with a testicular malignancy. The client expresses concerns regarding his sexuality. What information should the nurse give the client to address his concern? Should retain normal sexual drive and function. So, kung maka-affectuhan imong isa ka testis, napamakaya isa ka testis. So, it's not that much of a problem. A client diagnosed with seminal testicular cancer expresses fear and questions the nurse about his prognosis. So, testicular cancer DI has a cure rate of 90% when diagnosed early. So, malikudihas. The client with cancer of the prostate. So, the nurse is developing an educational program about prostate cancer. The nurse should provide information which topic. For all men age 15 older, kailangan o annual rectal examination. So, the nurse is caring for a client who will have a bilateral orchiectomy. So, tangtangan imuhang prostate. The client asks what is involved with this procedure. The results in reduction of the major circuit. And so, the nurse is developing an educational program about prostate cancer. The nurse should provide information about which topic for all men age 50 and older. So the nurse is caring for a client who will have a bilateral orchiectomy. The client asks what is involved with this procedure. Which statement is the most appropriate response? So I guess the 101 ko sagot. 101 is gahang na siya. Gahang jud siya. Bilateral orchiectomy, removal of testes. Results, orchiectomy is removal of testes. But we're talking about prostate. Results in reduction of the major circulatory androgen progesterone. That to reduce symptoms of progression of prostate cancer. So, prostate cancer related rin siya sa testes, no? So, results in reduction of major circulating androgen. Okay. So, hindi na ko ano self-control apply. There's a teaching a client about prostate cancer, which points should be included in the instruction list, because usually multifocal lesions slow growing, or adenocarcinoma, and incidence of prostate cancer is higher of men. Yeah. In Africa, what should the nurse do for a client who's receiving hormone replacement for prostate cancer? Suggested appointment may be made to see a physician Utilize communication strategies to enable the client to gain some feeling of control. A client asked the nurse why the prostate-specific antigen level is determined before the digital rectal examination because a prostate exam can possibly increase ang answer ano, increase the PSA. The nurse is performing a digital rectal examination, which finding is a key sign for prostate cancer. Nag-perform ka digital rectal, which finding is a key sign for prostate cancer. The nurse is performing digital rectal examination, which finding is a key sign for prostate cancer. Finding is a key sign for prostate cancer. So for prostate cancer, ang sa pinaka-key sign, bogi of the hard prostate localized or diffused, 105A. Yeah. So a client is undergoing total prostatectomy for prostate cancer. The client asked the nurse about his sexual dysfunction, which the nurse told the client, "This of prostate gland means that you will be infertile. There will be no ejaculation." Okay, so infertility ang cause of prostate gland. No ejaculation na dayon ka. So, 65-year-old, ano din, sa din it's pala sa prostate gland ay, parang wala na dayon siya ejaculation. The 65-year-old client has been told by the healthcare provider that his prostate gland has stage B, which is prostate gland at this stage is very slow growing. So, okay lang, prostate mo gland kami. Slow growing na siya, guys. A client with prostate cancer is treated with luteinizing hormone, releasing hormone agonist and antagonist. For any symptoms should the nurse instruct the client to expect while receiving this treatment. Flushing. So, magka-flushing siya. Guys, ang flushing ani kay lahi, dili siya katong radiation. Flushing is like hot flashes. So, a male client reports having impotence. The nurse should teach the client that which medication could be the factor antihypertensives ang sa impotence, diba? Beta blockers such as propranolol. As the nurse is settle on this man, crazy to the nurse staff. Am I crazy? No. UD is multifactorial in origin. Teach the client with erectile dysfunction to alter his lifestyle by doing which avoidance of alcohol can improve the outcome of therapy. So that's all.